Hello everyone and welcome to another training videos on how not to miss significant pathology while doing your shift or duty or while on call in A&E or in the hospital. This case is about a young male child, 13 years old, who came to A&E with right hip pain. The child was examined by the registrar on call and also had a radiograph because of the presenting pain on the right-hand side. And there was no history of trauma. So this was examined and being deemed as normal, then the patient was sent home. The main principle here is we have to understand that there are certain ages that are associated with specific pathology. And whenever we are presented with someone of this age, especially adolescents, we need to think of slipped upper femoral epiphysis, or what is known as slipped capital femoral epiphysis. Some people call it SUFE. It's important to detect this because it has got high significant morbidity if undetected and went to full dislocation or subluxation. And the way to look at this is we have to make sure that we follow a very specific rule while looking at this injury. And how to detect SUFE is by applying two different rules. Rule number one, you should have two views. One view is too few. We need to have an AP radiograph and frog lateral position radiograph. In this instance, only AP radiograph was obtained and it was reported as no SUFE, no abnormality, and the patient was sent home. There was no mention in the report that there was no frog lateral position, although this is now used as standard. So this is rule number one was not applied. Rule number two is you need to actively draw some lines on the radiograph to ensure that you're not missing subtle finding and subtle early signs of slipped capital femoral epiphysis. You may follow the cortical lines with your eyes. So this is the cursor here. If you leave it there without following it, then you follow it with your eyes. You actually can't see any big changes if you go from the left to right. And if I'm following with the cursor here, left looks fine, overall looks okay, there's no steps, there's no abnormality. As you said, we go all the way here, we check the eyes there, and then check the pelvis, looks fine, the arcs looks okay, everything looks fine. And then when we come here, again, there's nothing major if we are just skimming and following. But because we're looking for slipped capital femoral epiphysis, we have to look carefully at these two lines. So this is the epiphyseal, this is the epiphysis, this is the epiphyseal line. And it should be uniform and it should be parallel to each other. And it should be comparable bilaterally. It shouldn't be any widening. So if you go from here to there, it's all nice and similar width. But if you go from here, you can see it's slightly narrower here and slightly wider there. So this will actually put my alarms on that there may be something there. I mean, it's not very clear and it's not a definite, but I would get worried. The second rule you should apply, you should create lines. Lines should start from the femoral neck and drawn all the way along the femoral lateral aspect femoral leg. And if you can see, there's a wisp or there's a small area of bone that is intersected. So the line that is drawn on the lateral aspect of the neck should intersect and have some bone of the femoral head coming on the lateral side of this line. Now, if we took this line, apply it on the other side, so we do the same thing, get it here on the femoral neck, and then you draw the line. This will do this. You can't see a bit of bone here. So to make it easy for you guys, here we go. This is the right side and there's no bone. I'm gonna draw one again on the left side. We could have left it actually, but anyway, here we go. And you could say, oh, that's not really aligned, or you just get it down here, even it's worse now. You see a bit of bone here, no bone there. So this actually is really worrying and concerning. And I will speak to the registrar, orthopedic registrar on call, let them know about the finding of abnormality. And maybe in these cases, it's not straightforward. We would ask for an MRI because MRI will show it much better, will show the edema and will actually give us more definitive diagnosis. Unfortunately, this does not happen. No one did the lines and no one took notice of the subtle change in the width of the line that should be as narrow as this side here on the left. The patient then presented in a different day. So this was 25th of August, as you can see down here, presented on a different date and came with this. Now this is 28th of January. So this is nearly 5 months. So August, September, October, November, December, January. So after 5 months, presented again. And if you apply the same rules on the other side and this side, so let's do the line. So you can see a bit of bone here is crossing. And now let's see there, it's even worse now. Here we go. There's no crossing bone, but you can see now something different, a new sign, where you see the epiphyseal head here is narrower than the other side. And this is another sign of slipped femoral epiphysis. 15 versus 10. When it's smaller, it means it's slipped. So if you got rid of all these lines, as we were doing there, and look at the lateral frog position, which was obtained this time, and I'm sure you will never miss this. Now it's been missed on the first representation, and now it's come with more displacement and more dislocation, and this needs to be sent to the orthopedic team to consider treatment. Now let's give you a bit of background on slipped femoral epiphysis. This is usually common in adolescents, and it can be seen bilaterally in 20%. So whenever you see one on the right hand side, you should really check the left hand side and make sure you don't miss it, and don't assume this is normal until you do the lines. Make sure you draw the lines, otherwise you will miss subtle slipped femoral epiphysis like this case here. It's also worth mentioning that this is common in boys than in girls, and we understand that obesity is a significant risk factor. It doesn't have to be an obese patient or obese children, but obesity is known as a significant risk factor. And it's more common in boys and girls, as we said, and more commonly so in Afro-Caribbean than Caucasians. It usually presents with pain that progress into limping. So whenever you see, and usually present with hip pain that progress into limping. So whenever you see a child that is in the adolescent age with hip pain or limping, you need to think about slipped femoral epiphysis and really look carefully. So what usually happens is that with repetitive trauma, especially in obese children, you will see a widening of the physis, and this will happen usually during the growth period, and that's why we say it happens in adolescence. And you need to make sure that you are viewing two views. One view is too few, so you need to have an AP and frog lateral position before you can exclude a case of slipped femoral epiphysis. And if you're not sure, always ask for an MRI. And if this has been detected in one side, in some centers they would do prophylactic pinning on the contralateral hip, because it can happen bilaterally in 20% of patients. So although we don't see a slipped femoral epiphysis, so in some centers they would repair and pin both sides, both hips, even if there's only one which is showing dislocation. And of course, if it's untreated or delayed treatment, it can cause long-term degenerative osteoarthritis and can also cause femoral head avascular necrosis. And something we need to point out, why do we need to look at two views, is because it is a pathology that is better seen and easily seen on the frog lateral position more than the AP view. So if you only apply AP view, you're reducing your chances of picking subtle sign of slipped femoral epiphysis, as you can see in this case here. I'm confident that after viewing this case, you will never miss a case of slipped femoral epiphysis, because you need to think of it whenever you see any child at adolescent age, especially boys, especially Afro-Caribbean, coming with pain or limping with suspected slipped femoral epiphysis. Now you know that you need to ask for AP and frog lateral position and look at the AP and frog lateral position. Don't look at one view only. One view is too few, and make sure that you apply these lines when interpreting any case with slipped femoral epiphysis. Please let me know in the comments if you have any questions, and ensure that you share the learning points with friends and colleagues so that we all help deliver best and safe patient care. And thank you for your time.